Hi friends, this video is brought to you by Indian Medical Association Belgavi under the banner of Jagruti Abhiyan. Jagruti is like making people aware of various disorders. I will be speaking about vitiligo. Vitiligo is a common disease of skin where patient presents with white patches. In Kannada it is called as Bidu, in Marathi it is called as Kod. Now, though this disease doesn't cause any bodily harm to the patient, the main concern of the patient as well as the relatives is the presence of such white patches. And why this concern is mainly because of associated stigma of the disease. So there is so much of stigma in the society that any patient with a white patch is not accepted socially, and that is why the patients are mentally disturbed, and that is why they come or they seek for a medical help. The main intention of this video is to remove all these myths and misconceptions associated with the disease in the society. So how it is caused? Vitiligo is mainly a autoimmune disease. Now what is autoimmune is mainly self-destruction. So what exactly happens is our body produces certain kind of antibodies, and these antibodies go into melanocytes or the pigment producing cells of the body. So pigment are the color of the skin, like some individuals are very white, some individuals are very black. So these pigments decide that what has to be the color of the person. So these pigment producing cells, which are called as melanocytes, are destroyed by these antibodies. And so as the pigment producing cells are destroyed, there won't be any color production in that area, and because of that patient presents with white patches. So it is not a curse of God, it is not that it is contagious, it is not that it is because of eating something, but it is just an autoimmune disorder where the person's own antibodies are acting on his melanocytes. The other cause can be something called as chemical leukoderma, where a person comes in contact with certain kind of chemicals like used in leather industries or in rubber industries or some certain kind of bleaching agents. When a person comes in contact with such chemicals, he can develop leukoderma or white patches on particular areas where the person comes in contact with the chemical. And very rarely it is a hereditary, or it can be transmitted from parents to children, but it is not always the case. So all parents having that their children may not develop vitiligo. Now we will discuss about various myths associated with the disease. Now they say that it is a contagious disease. No, it is, as I already told you, it's an autoimmune disease. So it doesn't transfer from one person to another by mere touch. So anybody in the family, if he has got vitiligo, it is not that by touching that person or using his things you are going to get vitiligo. So it is not a contagious disease. Then second important thing is, it is not the curse of God. Many patients come to us, they think that it's a curse of God, they are mentally disturbed. It is not the curse of God, it is just a self-immunity disorder. Another important thing is, eating white will cause white. It is not so. Like eating curd, some patients say eating curd can cause white patches. It is not. It is not that white things or eating white articles will cause white patches. Then when patient comes to us, he is already mentally disturbed because of the disease, and he doesn't have any bodily harm as such or bodily problems. So what we do generally is, basically we ask the patients to do certain tests. Now why this test? As I told you, it is an autoimmune disease. So he may be associated with various other autoimmune disorders like pernicious anemia, thyroid disorder. So all these disorders we have to see if patient is also having any other disorder. So some certain tests are done to rule out any other associated diseases, and then accordingly the treatment is started. One thing you keep in mind, that all white patches are not vitiligo. It can be because of something called as pityriasis alba. It's a very common disorder which is seen in children, where they present with white patches on the skin. Now this pityriasis alba is a self-limiting condition where there won't be any, only a simple moisturizers can take care of it. Or white patches are also seen in diseases like leprosy, leishmaniasis, where patients may having some severe bacterial infections in the skin. So it is always better to visit your dermatologist to seek the help, to seek the diagnosis. And once the diagnosis is done, then only the treatment is started. Now why this is important? As in patients with vitiligo being patients with leprosy or pityriasis alba being treated for vitiligo. So that misdiagnosis, misconceptions should not occur in the society. Then once the patient is consulted, so once the diagnosis of vitiligo is established after thorough examination, we start the treatment. Now treatment depends on various factors. So after establishing a thorough diagnosis of vitiligo, what we do is basically patient has to take care of the skin. Now what is care of the skin is because the patches are white. It is not protecting the skin from the sunlight, and because of that we have to ask the patient to put the sunscreen so that the patches are covered, and so that will prevent the damage to the skin. And another thing is patient has to cover himself so that the sunlight will not damage the skin. Then what we do is basically we differentiate the patients or divide the patients into something called as stable vitiligo and unstable vitiligo. What is stable vitiligo is basically where the patient is not developing any new lesions, new patches on the skin, and the existing patches are there for at least 6 months to 1 year. And unstable is where patient is developing new and new patches every month or every 2 months. So that is called as unstable vitiligo. So for unstable vitiligo, it is very imperative that the new patches have to stop developing. For that, different kind of treatments are given so that the new lesions will stop coming. And once the new lesions have stopped coming, patient is converted as stable vitiligo and the treatment is started. For stable vitiligo patients, treatment is given so that we have to stimulate the cells which is giving pigment, that is called as melanocytes. So there are various drugs available in the market which stimulate the melanocyte. So now one important thing to tell here is we give drugs just to stimulate the pigment producing cell, that is melanocyte. The body has to produce the color. So definitely it will take a very long time for the complete treatment. Sometimes it might be 1 year, sometimes it might be 2 years or more than that. Now apart from drugs, there are various other modalities or methods available. Something called as phototherapy, where a patient is made to stand in the UV chamber, and then a specific light therapy is given. Another thing is something called as excimer laser, where excimer laser will give directly that light. Now what this light does basically is it will again stimulate the melanocytes or pigment producing cells to develop color in that area. With this modalities, the treatment duration can be lowered down and the results might be faster. And the next modality is the surgical management of vitiligo. Surgical is where some patients develop some vitiligo patches which don't respond to topical or medical management. Then we think of surgical management, where what is done is basically a skin from other area, mainly from the thighs or behind the ears, is taken and it is put on the affected area. It is called as transplantation of the skin. So it can be done either something called as split thickness grafting, punch grafting, or directly melanocytes can be taken from a donor area and it can be put on the affected area. So this gives complete color to the skin. So this is also a very important and good method available for the patients. So to conclude friends, it is very important that first thing foremost is vitiligo is treatable. Vitiligo can be cured also in some patients. Vitiligo, one thing, it is not contagious, so don't worry that somebody is affected. And most important thing is a patient of vitiligo requires your attention, your empathy rather than your discrimination. So I request all of you, kindly do not discriminate a patient of vitiligo and give them some empathetic approach. Thank you.